Hello, good morning, everyone. Welcome and thank you for participating in our webinar today, which is on emerging from the COVID-19 pandemic as a more resilient and kinder society. This webinar session is organized by the Leadership Institute of Sarawak Civil Service as part of its webinar series. Before we get started, let me introduce myself for a moment. My name is Razi Ahmad, a news presenter and broadcast journalist at TVS, and I'll be moderating today's webinar. First of all, I'd like to thank the Leadership Institute of Sarawak Civil Service for giving me the opportunity to moderate our upcoming discussion, and I'll do my best to navigate and steer the discussion between our distinguished panelists towards an engaging and hopefully thought-provoking direction. Let's get a little bit of housekeeping out of the way before we start. The webinar is expected to run for about an hour and a half. So you can go grab yourself some drinks, get plenty of snacks, and get real comfortable. You can expect each speaker to have the floor for about 5 minutes for each question. Near the end of the webinar, we'll conduct a 20-minute Q&A session. So feel free to submit your questions to any of our panelists in the chat window during the webinar, and we'll sift through the relevant questions and address them during the Q&A. I'd also like to add that our webinar is being recorded and will be aired on TVS at a later date. More info on that at the end of the session. Well, some introductions are at hand, though I believe these prominent guests need no introduction, but let's do it anyway. So I'd like to invite our panelists to turn on their cameras and their microphones. Hello, good morning.
Good morning.
Yeah, good morning.
Morning.
Good morning, everyone. I believe that Dr. Sabaria is...
You cannot, I cannot start the video. The host has stopped it.
Okay, that's all right. So,
All right.
No worries. As we'll wait for your video to come on, I'll just...
I'm okay now.
Okay, all right. That's great. Okay, so joining us in our discussion, first of all, is Dr. Sabaria Putit, who currently serves as Sarawak Deputy State Secretary. She is the first woman in the state to be appointed to the position, and she was given the monumental task of managing the performance and service delivery transformation in relation to issues such as the state civil service transformation, educational attainment of students, state public relations strategy, the people's welfare, sports, and more. Dr. Sabaria Putit also heads a committee that aims to increase the state's vaccination capacity and speed up the state's COVID-19 immunization program, among other crucial responsibilities in the fight against COVID-19. Next on the panel is Professor Dr. Ariba Kamaruzzaman, a professor of medicine and infectious diseases at University of Malaya, and an adjunct associate professor at Yale University. Apart from her contributions to fighting the COVID-19 pandemic, Dr. Ariba is a prominent expert on infectious diseases and is known locally and internationally for her work in HIV/AIDS research and advocacy. She is also the first Asian to preside over the International AIDS Society, and in April 2021, she was appointed a member of the World Health Organization's Science Council, the lead group that advises on scientific and technological advances impacting public health worldwide. We are also joined by Professor Dr. Rohaizat Yon, who was the former Deputy Director General of the Malaysian Ministry of Health prior to retiring in June 2020 and reappointed to assist the government in managing the COVID-19 pandemic. He has worked with the ministry for 35 years and became well known as Panglima COVID, for being amongst the individuals involved in the Ministry of Health's fight against COVID-19. He currently serves as the consultant public health physician at the Management and Science University, MSU, and sits on the Avicenna Hospital Board of Directors, as well as the advisor to Ali House Sdn Bhd, a subsidiary of BP Healthcare. And last but not least, we are joined by Professor Dr. Andrew Kew, who is the former Sarawak State Health Director and currently a professor of public health in the Faculty of Medicine and Health Sciences at University Malaysia Sarawak, UNIMAS. Dr. Andrew is well known internationally for his work in healthy cities and settings and has served as the WHO's short-term consultant on the subject. He has over 40 years experience in public health, involved in the management of disease outbreaks, notably the hand, foot, and mouth diseases, outbreak in 1997, SARS in 2003, Nipah in 1998, and is now a leading mind in the fight against COVID-19. I'd like to say thank you to our distinguished panelists for taking time out of their busy schedules to join us today. Welcome to the webinar, everyone.
Thank you.
Great to have you.
Thank you.
All right. Okay, so once again, the agenda on the webinar today is emerging from the COVID-19 pandemic as a more resilient and kinder society. This topic could not have come at a more important time as the country is reeling and in the process of recovering from the pandemic. Quick background setting in case you have been asleep for the past year and a half. The coronavirus pandemic has ravaged the world, and Malaysia has not been spared from the onslaught of the COVID-19 virus, although it fared better than most other countries during the early stages of the pandemic last year. The COVID-19 emergency impacts our society at different levels, affecting the human and social capital, institutions, communities, production process, consumption, and investment. The pandemic has also provided a warning to governments worldwide that new crises of unforeseeable nature are likely to emerge in the future. For Malaysia to rebound and become better prepared for future crises, we must boost the resilience of our society with a wide 360-degree all-encompassing approach. As Mauro Sefcovic, the European Commission Vice President for Interinstitutional Affairs and Foresight said, strategic foresight with anticipation, preparedness, not to mention kindness, at its core will be the key. So how can we prepare for unknown shocks? How can we make our societies resilient so that we are able to face unexpected changes in such a way that our well-being is preserved without leaving anyone behind and without compromising the heritage for future generations? And ultimately, how do we emerge from the COVID-19 pandemic as a more resilient and kinder society? Well, these are the sort of questions we will be asking, and our distinguished panelists here will be discussing their views, share their learnings in what would hopefully be an enlightening conversation for all of us. Right, without further ado, let us begin with the first item on the agenda. Dr. Sabaria, let's start with you. As has been evident in the past year, the COVID-19 pandemic is creating an evolving situation with varied impacts around the world. One of the emerging responses in fighting the pandemic is the strengthening of co-creation between the government and the third force, primarily the private sector, NGOs and citizens working hand in hand in managing a crisis. It has brought about a subtle shift from a public sector that focuses primarily on working for you to a public sector that works with you for you. Dr. Sabaria, as the Deputy State Secretary for Sarawak, you are tasked with managing responses to the COVID-19 pandemic through the leading role of the public sector. In Sarawak, have you seen this shift to work with the public sector for the people, especially from the third force?
Thank you, Razi. Yeah, first, I believe I would like to congratulate Leadership Institute, and also TVS for making this webinar appeal and reach to a wider audience. Congratulations to everyone as well for having the time, spending a little bit of your time for 1.5 hours to be with us this morning. And of course, now let me respond to Razi. To begin with, allow me to emphasize again the need for us to build back better in solidarity. This brings the very essence of the need for us in the public sector to work in synergy. Like what Razi has mentioned earlier, with not just the private sector, but to bring along the communities, the local communities, the local representatives and the NGOs together as the third force. Now, if we see the whole government approach is not enough. There has been, however, I've observed, and I think the last 2 years, we have observed Yeah, the emerging trends and this crisis indeed has brought our communities together, yeah, and even the public at large. Yeah, the NGOs come together assisting our government initiatives and those affected by the pandemic. Yeah. We can see the rising numbers indeed of the NGOs helping in our PPVs, for instance, ensuring that no one is left behind in supporting government initiatives. I think Professor Dato Andrew is also observing in Sarawak indeed. We are able to have that vaccination rollout in particular has shown a very successful example, where KKM, state and federal agencies, and even the other members working in synergy, at the grassroots level to make sure that, everyone, every villages, every longhouse, and every nooks and corner of Sarawak, the people are mobbed to ensure that they are getting the right vaccination allocated, And now, we can also witness what we call as not just in terms of supporting the healthcare system, but we have never seen this. Of course, we know everybody knows that this crisis is unprecedented, So you can see an alarming emerging trends, which I believe that we have witnessing, We thought that, prior to the pandemic, it's hard for us to actually push everybody, every communities to actually reciprocate, to this kind of situation. We never thought of it. But now the pandemic has opened up and has been a catalyst. In fact, we also witness where what we call as caremongering, trending now. In Sarawak, for that matter, we have Hope Place, Food Bank, Food Hubs, even our team in human resource doing the box for the nation, Of course, the White Flag Initiative says, and etc. I believe this is a positive trend, and a positive phenomena in which communities can come forth to assist the communities themselves. This is the third force that we see by default. The pandemic has allowed that kind of third force to be partnering with the government sector, and I think this is in solidarity. It's a good sign, and to build better and to move forward this in the future. I think, Razi, I'll stop here.
All right, that's great. So Dr. Sabaria is saying that the COVID-19 pandemic has resulted in the community coming together to help themselves, and that's a very positive thing that we can glean from the pandemic. Thank you for the really insightful answer, Dr. Sabaria. Dr. Rahaizat, this question is posed to you. There is a new COVID-19 variant of concern, the Delta variant, which is currently rampaging through many parts of the world, straining healthcare systems and threatening the effectiveness of our responses, such as the strengthening of co-creation, as explained previously by Dr. Sabaria. It is possible that fully vaccinated people can get infected with the new Delta variant, as has been evident. What is it that we must know about this variant? What measures are we taking, and how can the communities and relevant parties control and prevent or possibly reduce the emergence and spread of new variants? Doctor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Our moderator from TB Sarawak, our panelists yang bahagia, Datuk Dr. Sabaria Puttit, Sarawak Deputy State Secretary Performance and Service Delivery Transformations, yang bahagia Professor Public Health, Faculty of Medicine and Health Sciences UNIMAS, also as Sarawak COVID-19 Advisory Group, SCOVAG, also former State Health, Sarawak State Health Director, also yang berbahagia Professor Dr. Adibah Kamaruzaman, Professor, Faculty Society, all officers from Leadership Institute of Sarawak, from State Government of Sarawak, Datuk, Datin, Tuan-Puan, all listeners out there, selamat pagi rakyat Sarawak, and very good morning, and thank you for inviting me to share my little experience on this topic. Ya, apa kabar kita orang? Kabar baik ya. So for this question, I think all of you know that there are several variants already detected in Malaysia. There are several variants already detected in Malaysia. Variant Alpha, Beta, Delta, Kappa, Theta, and Eta already there in Malaysia. And the most dangerous, as all of you know, is the variant Delta, originated from India. And this COVID-19 virus, I think all of you know that this virus, this is the virus. It is very, very, very small. How small this virus is about 60 to 140 nanometer, about 60 to 140 nanometers. So it is equivalent with the size of our hair. Maybe you take one of your hair and you slice our hair into 1,333 pieces. We will get the size of COVID-19 virus. And a sneeze or a cough, I think, which takes about 150 milliseconds, but may transmit up to 3,000 droplets. And this droplet may stay up to maybe 10 minutes in the air. And majority of the mode of transmission are via droplet, number one. Number two, direct contact. And for variant Delta, also via the airborne. Hence, if you go out, please maintain to me 3 basic SOPs. Number one is minimum 1 meter physical distance. Number two, must wear mask. Yeah, must wear mask properly. This is very vital. Wear mask properly. It is not about wearing the mask, but now we talk about wearing double mask. Yeah, and if probably if you go to crowded areas because of the airborne, don't forget, buy this face shield. So wearing mask or double mask with face shield. And number 3 is frequent hand washing. And I think the best is just bring small sanitizer, and you can refill it regularly and wash it when you go out. And this variant of concern, such as Delta, spread faster, number 1, and causes higher mortality, number 2. And most patients do not display symptoms of cough or cold. They may just suffer joint pain, feel weak, lethargy, and loss of appetite. If you remember last year, one of our top senior officer, they just complained of weakness and lethargy, and it turned out to be positive. Yeah, and VOC spread directly to lungs, and inflammation is detected only by X-rays, and screening might be negative. So this is the characteristic. Are not for Wuhan COVID virus, the Wuhan COVID, 100 positive patients will infect at least 150 people. Whereas R naught for variant Delta is nearly 3 times higher than Wuhan, i.e. between 5 to 8. Yeah, the R naught of this Delta virus is between 5 to 8, meaning one positive patient will infect up to 800 people. And variant Delta, as I mentioned just now, it is very infectious and causes higher mortality. And until 22nd July, last Thursday, Malaysia detected 429 cases of variants of concern and variants of interest, variant of interest, VOC and VOI. And the highest state is Sarawak. Yeah. Out of these 429 cases, 151 or 35.2% were from Sarawak. Yeah. And from these 151 cases, 93 were variant Delta. So there was occasion, there was occasion whereby when we did the swab was only positive on day 11. Sorry, the swab was only positive on day 18, for variant Delta, day 18. Therefore, duration of quarantine has been changed. If you recall, rechange. I mean, not change, rechange. It was 14 days before, and then after that, 10 days, and rechange on the 24th of May. Those who come from India, Sri Lanka, Bangladesh, Nepal, and Pakistan, 21 days, the quarantine period. 3 days before they arrive, they must do the swab, must be negative. On the arrival, they must do another swab and repeat the swab on day 10 and day 18. That was for India, Sri Lanka. And for the rest of other countries, the duration of quarantine is 14 days. And then 3 days before they arrive, they must do the swab, must be negative. On day of arrival, we repeat the swab and repeat also the swab on day 10. So this is just because of the virulence of Delta virus. And beside Razi, beside the public health activities, I think our speakers will, other panelists will talk about public activities. But beside these public activities, vaccination is the way to go and to be protected. I will elaborate this further, the benefit of vaccination later. But to help quickly stop the transmission of the virus, these public health activities, these public health activities must not only be implemented or be carried out by the Ministry of Health, but it's very important by all other government agencies, by private sector, NGOs, community. For example, Ministry of Human Resources, very important, implementing the Act 446. Ministry of Local Government, prison authorities, employers, very important. Employers, you must provide accommodation, provide sanitization at your office. Factories, factories, and private industries, private firms, district officers, head of villages, rumah panjang, and so on, in line with the real whole of government and whole of society approach. It is not just theoretical, but should be the real one. For example, targeted testing and screening. Should do targeted testing and screening, not only by MOH, also by other agencies, by private sector, and focus on selected clusters, like cluster tempat kerja, and then cluster tempat kerja together with penginapan, and their quarters and so on, prison, detention center, selected community. That's one. Number two, after screening, while waiting for MOH, this is very crucial. One testing was conducted, and then it turned out to be positive, or it's the contact of positive patients. So while waiting for MOH, please continue contact tracing and self-isolation with the help of employers or ketua kampung or family member. This is very crucial because the cases are too many. So while waiting for MOH, in some universities, I noticed that they found positive. They did the contact tracing, the isolate. They don't close the university. Unlike one university, they have to close the whole university because you cannot wait for MOH. You have to do it yourself. And then after that, when you have done that, after the screening, you do the isolation, you do the contact tracing. After that, do the sanitization, whether you get help from Bomber, the local authorities of other agencies, targeted sanitization. And employers must provide adequate accommodation facilities and for the employees in line with Act 446. Because, we notice, when they do some of the checking, some of the accommodation that they provided, we saw that basically it is a container. A container is divided into two. The container is divided into two, become two levels. The container is already quite low, and you divide that into two levels, and level 1, 15 people, level 2, another 15. So one small container accommodates 30 people. So you can see one person get positive, the whole container will get positive, and the whole tempat kerja will get positive. And then beside that, number 5, community empowerment is very, very crucial. Stay at home, you need to go out, but if they need to go out, implement 3 basic immunization program. To me, the 3 basic vaccine available, this is vaccine yang tak ada suntik punya, simple. Physical distancing 1 meter, wear mask properly, and then bring your sanitizer. So that is for at the moment my input on this, and I hand it over back to our moderator, Encik Muhammad Razi Ahmad Akbar.
All right, thank you, Dr. Rohaizat. So the Delta variant necessitates that we take a much more severe restrictions and much more holistic approach and hands-on approach across all levels of society when it comes to taking COVID measures. Those are very sensible words of advice from words of wisdom from Dr. Rohaizat. I'm sure everyone here in the webinar will take that to heart. Also, since we have almost 900 participants in the webinar, I would like to remind those who just came into the webinar that you can submit your questions in the chat window, and we'll read them out during the Q&A session near the end of the webinar. So yeah, moving on. All right, so as we must be resilient against new variants, so too must we be resilient in other aspects. One of these aspects is the resilience of our workforce. Pandemic has ruptured work for millions of people across the globe, leading to a long and painful period of uncertainty and anxiety. Being able to work is central to many aspects of life. We must work to survive and build a life. It ups our capacity to contribute to society and achieve meaningful acts. We can build and strengthen social connections, and it enables us to prove our self-determination and our self-worth. Thus, we must ensure that our workforce must be safeguarded against the potential loss of their jobs due to crises such as the COVID-19 pandemic. Dr. Adiba, this question is for you. I'd like to ask you, how can we better protect our workers all around?
Assalamualaikum and good morning, Razi, and thank you very much to the Sarawak Leadership Institute for Civil Service for inviting me this morning. Yeah, I think when you talk about how to protect workers, there are many, many different types of workers here. There are, of course, office workers. There are those in the service industry that meet people every day that are going to be at more risk of the infection. There are people like me, the frontliners, people like me, and you know, those in the police force and others that have direct contact with the public. And then there are those who are informal workers whose own economic livelihoods have been threatened by the virus because of lockdowns. Then there are those working in factories, you know, who are also at risk, as we know from the different clusters that we have. So when we talk about protecting them, I think, or protecting us as workers, I think it's very important to look at the different risk levels that we experience. So obviously, you know, the vaccination is going to be one of the most important things. And Alhamdulillah, you know, in terms of vaccination policy, we have provided vaccination for frontliners, but perhaps now it's also important to look at, you know, and the policy also covered, like it did for, you know, high-income countries, those at high risk of getting severe disease, and that's obviously very important, you know, those over age 60 with comorbids. But I think now it's also now that, you know, we know and we see the pattern of disease in our country, it's also important to step up the vaccination to, you know, those at very high risk of infections in factories, in clusters. And I think, you know, small, medium enterprise, hawkers and people like that whose very, very income depend on and livelihood depend on them remaining well. So so that's from you know, protecting them from the disease, and you know, the best weapon we have for that right now is the vaccine. So looking at how we prioritize our vaccination strategy is going to be incredibly important. Number two, I think obviously mental health has been discussed a lot, and you know, resilience and you know, coming out of this pandemic unscathed also depends on protecting our mental health. You know, I can only speak for my colleagues in as frontliners in the healthcare you know, industry. We're all exhausted, and you know, it's not just the sheer exhaustion, physical exhaustion, but mental exhaustion of seeing, you know, patients dying, the stress of not having enough this and that. So providing support for healthcare workers and others in the front line is very important. At our hospital, we have a team that provides mental health support for nurses, doctors, anyone who needs it, anonymously. And also, especially early on in the pandemic when we were not vaccinated, that real fear of getting infected ourselves and or infecting our loved ones and family members. So counseling support, mental health support is very important. Thirdly, I think for the general public and for you know, workers, you know, within the civil service and all that, equally that mental health support is very important, because now, you know, more and more people are getting infected. Many people may know of someone or have lost someone to COVID-19. So, you know, that counseling and support should be provided. And I think for those in public service, getting timely and accurate information is extremely important. I think risk communication and communicating accurate information, whether it's in how the disease is transmitted, and if someone has been infected, where do you seek help? How do you look for, you know, how do you protect yourself? How do you self-isolate? All that information is important. And especially now we live in a world of misinformation and disinformation. You know, the number of WhatsApps I have received on ivermectin and all these things that leads to confusion for people who are not, you know, in the medical world, and may seek, you know, alternative medicine. And then, of course, there's the issue of vaccine hesitancy because of misinformation and disinformation. So I think engaging with our stakeholders and you know, our workers, whoever they may be, in language that is understood. And when I say language, it's not just the dialect. I mean, I'm aware that in Sarawak, you know, you have more than just Bahasa, English, and Tamil and Mandarin, etc. You also have to cater for all the different you know, Sarawakian dialects, and that's very important. So one is the language, the language. The other is, you know, making it understandable, making it able to be related to people who you know, need to understand the message. I think that's equally important as just paying attention to the dialect itself. So I guess in summary, you know, vaccination and sort of the medical protection, the public health protection that's needed. Number two is mental health support, and number three is always communicating the right message. And number 4, as is the title of this webinar or panel, is, we all need to be kinder to each other. I think there's now no place for politics, no place for being mean to each other. We need to get out of this together, and we need to do that by being kind to each other.
Thank you so much, Dr. Ariba. I'd like to also express my gratitude to you for all your hard work, and I appreciate the struggles of all frontliners in fighting the pandemic. Dr. Andrew, I'd like to pose this question to you. Dr. Ariba touched on misinformation and disinformation, which means that the role of public communication in managing a pandemic is critical. At a time when citizen trust and compliance with measures from lockdowns to hygiene guidelines is of utmost importance, a surge in disinformation is undermining government responses to the COVID-19 pandemic and putting people's health at risk. And what would be our role in counteracting disinformation and supporting government policy? And I'd also like to add, with regards to complying with COVID measures, do you think people will accept giving up their data privacy for the sake of their safety from COVID-19? Dr. Andrew?
Hi, Razi. Yeah, thank you. Good morning. And to you and to fellow panelists and all the people who are joining in for this webinar. Yeah, for this COVID-19, there is so much information out there, so much information being generated. The World Health Organization have termed it an infodemic. So this information, I will broadly, I think we can broadly classify them into 2. One is the academic and technical information. These kinds of information are usually vetted by peer scientists and so on. So in a sense, we can trust most of them to some extent. Of course, there are still places where, because of the speed of the research and so on, the quality is not as good as with some of the others. And in fact, they've come up with a term for this. It's called wasted research in a way. But the one I want to emphasize now is the one that is not the academic or technical, but those that are circulating in other media, social media, such as WhatsApp and so on. And this category of information generally is not vetted. So there are 3 possible groups of information that are out there. Of course, the first one is misinformation, which is an accidental error in a way, an unintentional mistake. For instance, the statistics may be wrong, the translation may be wrong, and so on, but there is no malice involved. The second one is disinformation. This is a deliberate fabrication and manipulation of data and so on. And these are the ones that leads to conspiracy theories, rumors, and so on. And these are the ones that we have to be very careful of. And to the layman, sometimes it's very difficult to distinguish these kinds of information, disinformation, because it looks like they are so real. And the third one, minor, but it can be very important as well, is what is the malinformation. This is a deliberate publication also of private information, personal information, but it is for the personal interest of the person who uploads this kind of information. It's not for the public, but they just want to get angry with the person and do something bad. So that is malinformation. So why is there so much misinformation in the social media? Well, it's because this is a very new disease, and once you have a new disease like this, according to Peter Sandman, has termed this kind of things as outrage factors, because people judge this kind of events not according to scientific data, morbidity, how many people have it, how many die, but they judge it according to other measurements, such as trust, whether they can control the situation, whether they can, whether getting the infection is a voluntary thing, how much dread there is, and so on and so on. So you can imagine that with COVID-19, we have a lot of these outrage, so-called outrage factors. Okay, and this is the ones that lead to a lot of disinformation. Unfortunately, these kinds of disinformation happens in certain groups, what they call echo chambers, because they send it to each other, and they are not aware of the scientific information. But even if they are aware of it, they believe their own information more than in others. Okay. So how do we deal with these kinds of disinformation and so on? The first one is to evaluate the source. There are many sites out there, even for Malaysia, they have something called Sebenar or something like that, and many sites. But people who believe in this information will say that these sites are wrong as well, and they will say that they have a personal interest in countering what they believe in. The other one is what we call to triangulate your sources. Is this found in other sites, or is this found in only one source, and so on? And the third one is that we have past experience with certain kinds of and certain groups of speakers. For instance, if they have lied to us in the past, then we should not believe what they are writing, what they are propagating out there. And the last one is that if people are telling you theories about COVID-19 and so on, you ask them what is the basis of this, and if they cannot explain it to you, then probably they have no business telling you all this misinformation, because they themselves don't understand it. They have no credibility in it. Okay, but beyond the personal level, this philosopher and writer, Professor Yuval Noah Harari, probably some of you may have heard of him. He wrote something which I think is very important. He said for us to follow all the guidelines, the things that were mentioned just now, the 3 C's and so on, people have to trust. We need people to trust. And this trust is based on 3 things. They have to trust the science, that what people tell is based on science, based on evidence. They have to trust the public authorities, the decision makers, the politicians, and so on. And they have to trust the media. And this media, I think we are going to talk about mainstream media, because the other media such as WhatsApp and so on, as I've mentioned just now, they tend to have a lot of disinformation. So what is this lesson that we are talking about? There are, especially in the US last time, we can see that the former president purposely did not believe in science, and many of his supporters did not do so. But even among our local situation, the public authorities must maintain that trust. You cannot have double standards, and you cannot have excuses, because once you lose that trust, then it takes a long time to gain it back. Trust have to be earned, and it takes time to earn trust. But to lose trust, you can have it just in one day, or even just one occasion. And once you have lost the trust, people will not listen to what you say anymore. So this is very important for us, and so on. Regarding personal data and so on, I think the ethics issue in this kind of situation is that there are 2 kinds of ethics. One of them is that we protect the personal data, our personal information, and so on. So that is personal good, what is called good. Whereas for when we manage epidemics, we have no choice but to look at the public good. So sometimes we have to sacrifice our personal information, our personal good, for the sake of the public. Just to give an example, in the early phase of the outbreak in Sarawak, when people put the this coffee shop has a case, this mall has a case. The coffee shop's concerned and the mall's concerned were very upset. They said, why do you name us, and so on. And but now people are accepting this already, and it is useful public information. Unfortunately, some of them we are still not able to name names as what it should be. For instance, some of the clusters, for instance, are still quite vaguely named after a road and so on, when the public knows that it is a certain factory and things like that. So I think we have to sacrifice our personal information and so on for the public good, because the public good in the end is also our own good for our personal gain and so on. Okay, Razi. So thank you. I stop here for the moment.
Right. Thank you, Dr. Andrew. So I guess it remains to be seen whether people would, give up their data privacy for the sake of their safety from COVID-19. All right, moving on. This question is posed to Dr. Sabaria. Doctor, emerging stronger after COVID-19 demands resilience. One of the key components of resilience is to move with speed in our operations, for instance, in end-to-end COVID-19 digital solutions. Sarawak is lucky enough to have embarked on an early digital transformation journey, and this has prepared the state to face the issues and challenges of the COVID-19 pandemic. Now, how exactly has Sarawak benefited from Chief Minister Datuk Padia Bang Johari Tun Openg's digital strategy, and what lessons learned can the Sarawak Civil Service act on moving towards the future? Datuk, I think your mic is muted.
Right. Thank you, Razi. And of course, I'm very happy indeed to have all the professors here. We have been learning a lot from the experts, and I believe our public servants who come almost 1,000 in numbers. Now I'm very happy that they are here with us. Yeah, indeed, as I said earlier, this pandemic has become a catalyst to a lot of our transformation. Indeed, yeah, and in fact. In realizing our digital Sarawak, which was aspired and led by our YAB Chief Minister in the year 2017. Yeah, I think we are quite blessed in that sense. Yeah, but to be honest, I think some of the public servants here among us, yeah, when we started in 2017, many of our citizens alike here, and also our public servants, some, are very skeptical about the agenda. Yeah, because being a developing nation, a developing state, trying to achieve to be a developed state, and here we are trying to quantum leap into a digital economy. Yeah, this is something that is also unprecedented. Yeah. But as I said, the demand, if you can see the pandemic itself, the demand for digitalization of public service, yeah, and a digital government initiatives become the order of the day as a response to our civil service to operate amidst this pandemic. Yeah, and if I think most of us here, like today, yeah, working from home as a new normal, and still remain as the best option to mobilize the machinery. Yeah, remember at one time, early years last year, we were quite shocked to have everybody working at home. Yeah, and in fact, we are trying to struggle with, hey, is this going to be long? Is this the way we're going to operate? But now look, everybody are quite comfortable, I must say, yeah, that working from home become a normal thing, yeah, and of course with this SOP that we desired to have, yeah, to cut the chain of the transmission, we have to reduce face-to-face interaction, yeah, and the increased use of digital government initiatives become very very well accepted. Yeah. For example, our Service Sarawak, yeah, one of the key initiatives that we have, yeah, when it was closed, there are increased demands for online services and online help desk. Working from home indeed increased demands for digital platform. Thank you, Mai. I saw the nodding. Yeah, working from home increased the demands for a digital platform and facilities, of course. Yeah, and online learning, even for Leadership Institute. Yeah, you guys here actually has to adopt and adapt more e-learning platform, and I think it become the mainstream of training platform for the state. Yeah. Not just for the public service, but in fact, you can see many sectors have turned to digital platform. For example, many businesses and entrepreneurs that has been impacted by this pandemic, yeah, who has come to e-commerce platform, and indeed, the whole nation, yeah, Malaysia e-commerce growth as one of the largest in the Southeast Asia, according to Google, yeah. Then at the same time, we are left with no options but to continue learning and having our education sector on digital platform. Yeah, this signifies the need for obviously a good connectivity throughout the whole nation, more so in Sarawak, both in urban and in rural settings. Yeah, this is the challenge that we have. Yeah, but however, in fact, the state government, as you know, under the able leadership of the Chief Minister, has embarked much earlier, in fact last year, in providing the digital connectivity through the SMA 300 Tower initiatives, and of course the visa technologies in certain areas, yeah, through the existing SarawakNet infrastructure that we have. Yeah, our initiatives even to the level, I think the last IDEX, yeah, or International, what you call digital economy conference that we have every year, yeah. In fact, we have launched what we call as digital community centers, yeah, and could now be expanded to every nooks and corners to provide the platform for e-commerce, for e-learning, at the local or at the community level. This has become very, very useful. Yeah, and indeed, I believe this is the way forward. Yeah, and I would like to end on this note, especially for your questions relating to the digital strategy that the Chief Minister has endorsed much earlier, has become put it this way, has become into a full-fledged, the need to go into a digital platform as the order of the day for Sarawak and the whole nation. Yeah, Razi, back to you.
All right, thank you, Dr. Sabaria. That's a very fascinating explanation. I can tell you're very passionate about this subject. So, all right, moving on to the hot topic on the news, which is vaccination. Let's start with Dr. Rohaizat. Dr. Rohaizat, as Malaysia's COVID-19 vaccination drive goes into full gear, there are still citizens who are deeply skeptical about vaccinations. And they are not just isolated to a particular group of people. Now, vaccine skeptics come from all walks of life and social backgrounds, be they the highly educated, the elderly, rural folks, some Muslims who are concerned over the halal status of vaccines, among many others. It is important that we continue to educate citizens on the importance of vaccination. Doctor, what are the benefits and how does it impact society and the economy?
Thank you, Cik Mak Razi. Earlier, I briefly mentioned about vaccine and vaccinations, and there are numerous fake news, as mentioned by Dr. Andrew, and creating fear toward vaccination, and these rumors further intensified by anti-vaccine movement. Yeah, and I think all of you know that all over the world, countries all over the world have given permissions to use vaccine for emergency purposes. And following that, our listeners out there, following that, billion of people have been vaccinated, billion of people. And data has been collected and analyzed and have shown that the safety and the effectiveness of the vaccine, which I will say that the benefit is much, much more than the side effect detected. And what happened in Malaysia, our National Registry, National Regulatory Pharmaceutical Agency, NPRA, has analyzed and given the conditional approval. Yeah. So number one. Number two, and for the Muslim, as mentioned just now by Encik Mak Razi, not to worry, because our religious authority, JAKIM, and we have discussion with them, had come up with the fatwa, had come up with the consensus via Muzakarah. This Muzakarah with all the Sahibul Sama'ah, all Sahibul Sama'ah in all states. And the hukum is halal for public. And the vaccine to be vaccinated, halal for the public to be vaccinated, number one. Number two, it becomes wajib for the frontliners. So the JAKIM already made the statement, fatwa on this. And under this national immunization program, public will be ensured access of vaccine, which will be given free. And to increase the access, it is not just one type of vaccine being purchased. Instead, currently there are 3 types of vaccine that have been purchased by the government, namely Pfizer, AstraZeneca, and Sinovac. And I think other type of vaccines are also being analyzed by the NPRA. And I appeal listeners out there, please register for vaccination using MySejahtera. And all of you know that now, maybe I'll inform again, MySejahtera now has been upgraded. Yeah, the MySejahtera has been upgraded, and it has numerous capacity. You can change your address, you can change the appointment system, and many, many more. It is not just data on COVID. So capitalize MySejahtera for that. And what are the experience of other countries that using Pfizer and Sinovac for vaccination? You know what? I give 4 results that have been detected for Pfizer and Sinovac. It reduces the risk of infection. This is other countries, you know. Reduces the risk of infection can be up to 65%, number one. Number two, it reduces hospitalization. Number 3, it reduces the ICU admission up to even 90%. And number 4, it reduces death by 86%. These are the experience of other countries. And look at UK. Earlier, 1 death for every 50 cases. After massive vaccination, the deaths now reduced to 1 death for every 1,000. And look at Singapore. Singapore now already reached 60% vaccinated people been vaccinated in Singapore. And now many sectors are already open. Schools, dining, offices, entertainments are allowed. Okay, let's see what happened in Malaysia. Yeah, what happened in Malaysia? Our local data have shown that vaccination has reduced the rate of infection. Number 1, and even if that person being infected, the infection is basically very mild, and it reduces the rate of hospital admission. The same, quite similar finding with other countries. I think all of you know that the frontliners, the frontliners, i.e. the healthcare workers, how many of them all over Malaysia? Dr. Andrew Q, maybe about 250,000, our healthcare workers, all of them have been vaccinated. And then until now, how many percent got infected by COVID? Very, very, very few. I think less than, from this more than nearly 200,000, our frontliners, healthcare workers, only 2,008 were infected. You can see, meaning this vaccine really protect them not from getting the infection, because 2,008 only been infected. And from these 2,008, how many basically category 1, category 2, category 3, and category 4? Only 6, 6 only fall under category 3 and category 4. The rest are category 1, meaning 1 or 2, meaning vaccination will reduce the rate of infection. Even if you get infected, yeah, the severity will be very mild. And then the percentage of getting admission is quite low. And another data, this is in local hospital, MOH hospitals, that previously ICU were full with elderly people, yeah. But now the trend, you know, admission in ICU is overtaken by the young people. You know why? Among others, because young people get more infections, and from the data have shown that majority from age 20 to 40. Why? They are working people. Yeah, they get from cluster tempat kerja, cluster community. Yeah, and look at that, the ICU trend. Initially was elderly people, and now young people overtaken. That is why, because you know why? Elderly now fast phase through. Yeah, the phase 2, the vaccination for elderly now will be coming and coming and coming. More of them be protected, but the phase 3, some state has just started. Some state already doing very well, but the young people still not getting vaccination. That is why you can see the trend of ICU admission is increasing among young age group. Therefore, from this explanation, I urge all of you down there, listeners, our colleagues, our friends, our relatives in Sarawak, listening to this program, please promote and encourage vaccination. And again, beside that, while being vaccinated, you must still follow the SOP. You must still wear the mask, and also you must avoid getting infection, because I mentioned you might get infection from others too. And if you do get infection after being vaccinated, your infection normally quite mild. All right, but you get infection, probably few of you get infection, it is mild, but you might not realize it. If you don't wear mask, you meet others which are not yet vaccinated, you will transmit your virus to that particular person who are not yet protected. So until we get the enough, what we call the herd immunity. And again here, yeah, my advice is, it is not just about vaccination. I think all of you down listen, our colleague, our friends, Rakyat Sarawak down there, you listening to this program, I think you have heard about long COVID. I think you have heard about long COVID. What is long COVID? Long COVID is a sign and symptom that develop during or after COVID infection, yeah, up to 12 weeks or more, are not explained by alternative diagnosis, yeah. And this sign and symptom may reduce your quality of life. And then you might get what? The psychological problem, psychiatric problem, neurological problem, respiratory problem, ENT, and then maybe cardiovascular, gastrointestinal, dermatology, and musculoskeletal. So my advice is, please, yeah, do not listen to the fake news, and please proceed with vaccination. On the latter part, I will explain to you. I would like to sort of congratulate Sarawak. I think I reserve it for my next session for the ability, you know, getting people of Sarawak being vaccinated. I think this is the second highest in Malaysia as compared to other states. With that, I hand over the session back to you, Encik Muhammad Razi Ahmad.
All right. That's a very long explanation, a very passionate words of wisdom from Dr. Raizat. There is a mountain of evidence supporting the benefits of vaccination, plus getting vaccinated is now easier and more accessible than ever. So I hope Dr. Raizat's words could change the minds of any vaccine skeptics out there. So we can hopefully vaccinate everyone and get out of this mess sooner rather than later. I would also just like to remind our audience that you can submit your questions to our panelists in the chat window, and we'll choose the best questions and throw them to the panelists during our Q&A session, which is near the end of the webinar. All right, moving on. This question is for Dr. Andrew. Sarawak's goal is to achieve a vaccination rate of 80% of the total population by the end of August this year. That's, I I believe 100% of the adult population over 18 years old. This is, of course, in line with the National Recovery Plan. So where are we now in our vaccination campaign, Doctor?
Okay, thank you, Razi. Before I show some slides on where we are now regarding the vaccination, I would like to emphasize again, like what Dr. Haizat mentioned just now, that vaccination is a very important component in the control of COVID-19 pandemic. Okay, but it's only one component. It's people have mentioned that this is like Swiss cheese model. There are many, including hand washing, wearing masks, social distancing, physical distancing, and so on. And COVID-19 vaccination, none of them are perfect on their own, but together they can plug in the holes from the other interventions such that we will be protected from getting the infection. With regards to COVID-19 vaccination in Sarawak, we had many challenges for us, and some of them seem insurmountable in the early phase of the outbreak. For instance, who can imagine that in Sarawak we can maintain the cold chain at -70 degrees centigrade for the Pfizer? We were very worried about it, but in the end we have shown that it is possible. So among the challenges that we faced were political. We had to speed up our vaccination program such that we can vaccinate 100% of the adults, people above 18 years old, by the end of August. This is because, as we are all aware, our Dewan Undangan Negeri, their term expired from the 7th of June. So the only thing that prevented Sarawak from having the state election is the declaration of the emergency. So once that is lifted, then we have to hold our state election, and we must hold the state election in a safe environment, which means that our COVID-19 cases must be brought down to a sufficiently low level, because the Sabah experience showed that after the vaccination, the number of COVID-19 cases, the new cases reported, was like 18 times what it was before the nomination day. Just imagine what would happen in Sarawak if we had 18 times of what we have now. We have about 400 cases every day times 1800. That's something that we cannot manage. So we must bring the cases down and so on, so that it's manageable. And and they also show that the increase in the number of cases from the Sabah election, 70% of that increase was directly due to the election. Okay, so that is a big challenge for us, the political challenge. The second one that I've mentioned is a technical challenge, -70 degrees centigrade for Pfizer, for instance. The geographical challenge, because we have such a big land area, we have poor transport, we have scattered population, and especially among our friends, the Penans and so on, it's very difficult to access them. And the final challenge, which I feel very important, is a social one, where not everyone have MySejahtera app and they cannot register. Of course, we have the vaccine hesitancy. We have still undocumented Sarawakians through no reason of or theirs. And of course, there are foreigners working in the plantation industry as well as in the logging industry. So those people need to be vaccinated as well, because if we don't vaccinate them, then they will be at risk and they can transmit it to the whole of us as well. Okay, so now I would like to show you some slides which yeah, let me move the thing here, which is shared by Razia from Sarawak Health Department. The report is as of 24th of July. Dr. Razia is the one who is mainly in charge of the COVID-19 vaccination in Sarawak. So we have we can look at this from two targets. One of them is the total population. When we talk about herd immunity, usually we talk about the whole population, and the target for that taken generally globally is broadly accepted as 80% of the total population. And you can see from here that the first dose and the second dose, some of the divisions that still have a lot to go is Kapit. Those of us who are in Sarawak, we know the reason for this because of logistics problem, transport problem there, Sri Aman, Muka, and so on. So as with the total population as the denominator, we have achieved about 60% of the first dose. This is important because all those who receive the first dose hopefully will go into their second dose. And for the second dose, which is the completed vaccination, is 40%. And we have given 2.8 million doses of vaccine already. So this is a very good achievement, given our constraints that I mentioned just now. But if we look at the adult population, it just so happened that in Sarawak, people who are 18 years and above form 80% of the population. So if we look at those who are 18 years and above, then we are looking at 100% coverage of this group of population. And you can see for those one, for instance, we have done 82%, and for those two, 56%. So you remember that this one we are hoping for 100%, and for here we are hoping for 80%. So we still have ways to go before the end of August. Okay, and if you look at the trajectory of it, you can see that we started in 26th of February, where our Yang Amat Berhormat Chief Minister was the first recipient of the vaccine in Sarawak, but it didn't pick up as good as we expected. This was because of the vaccine supply, which affected the whole country. And it started to pick up from the June, the week 24 of the year. This is about the 13th of June, and it started to pick up. And we have a few of the major pusat pemberian vaccine, including the one in BCCK and Unimas, which gave in some days more than 5,000 doses a day. So they have picked up very, very well. Okay. The other thing to note is that because of the vaccine available during that time, 80% of our vaccine is Sinovac. Okay, and Pfizer form only 16%, and AstraZeneca is very little. And in the end, all this 81% will migrate here later on to get those two of the vaccine. Okay, and if we look, yeah,
Dr. Andrew, sorry to interrupt you, but we're running out of time, so
okay.
Sorry to interrupt you. Yeah, I hope Sarawak can achieve its vaccination target by the end of August.
Yeah.
Now the state can navigate the state election carefully and deliberately, so we do not have a potential outbreak like the election in Sabah. So
Yeah,
moving on. Yeah, right. Thank you, Dr. Thank you, Dr. Andrew. Yeah. So moving on to Dr. Adiba. This country, we are now in the race to vaccinate almost everyone, as no one is safe until everyone is safe. Ending this pandemic is a collective challenge that requires an equitable distribution of vaccines among and within countries. Failing to do so will imperil the global inoculation drive and will threaten economic recovery worldwide. Vaccine equity is both fair and efficient. All countries and regions will stand to gain from a stronger, faster global economic recovery. It is in everyone's interest. Now, as a country, how has this equitable distribution impacted our vaccination program? And internally, what would be the role of organizations and society as a whole in making our vaccination program a greater success? What is next after the vaccine? We have 5 minutes, Dr.
Yeah, thanks, Razi. And before I proceed to answer your question, let me congratulate the state of Sarawak and the state Health Department on that amazing achievement. Yeah, it wouldn't have been easy to get to 80% of or 100% coverage, and of a first dose like what you have achieved, especially given the geographic distribution of and how vast the state of Sarawak is. So huge congratulations. I also had the opportunity last night to review some EPID analysis, and concurrent with your expansion of vaccination, you can see the decrease in the incidence, in the number of new cases in Sarawak. So that's good proof that vaccination is incredibly important. So congratulations. I guess before the panel discussion, Prof. Andrew and I he was a bit concerned that Sinovac is the main vaccine that's being used, but I think hence surveillance and looking at breakthrough infections is going to be important. The question of mixed doses and boosters are still up in the air, but Sarawak may be able to provide the leadership in this in terms of maybe even research into mixed doses as well as booster, given the predominant use of Sinovac as your first dose. So back to your question, Razi, in terms of vaccine equity, yeah, I think first of all, at the global level, it's really worrying that Africa, the entire, in a way, Malaysia has done well by going all out to procure vaccines, and we have to give credit to the federal government and YB KJ for that, because I think for the entire African continent that they've only managed to vaccinate less than, I haven't looked at recent figures, but as of last week it was only 4%. And so, with us racing against the mutants and the variants, this is a concern because, what transpires in Africa is not going to stay in Africa. The so-called African variant, the Beta variant, is actually, as far as I can tell from whatever data we have in Malaysia, is the predominant variant right now. Of course, Delta is catching up fast, and then with the Beta variant, breakthrough infections, vaccines, even AstraZeneca and certainly J&J vaccine don't perform as well with the Beta variant. So, at the global level, making sure that everybody is vaccinated as quickly as possible is going to be huge. In terms of Malaysia, I think our problem still is, even looking at states, Sarawak has done really, really well. Again, I was looking at the vaccination coverage. Sabah is not doing well at all in terms of vaccination. I'm not quite clear what the problems there is, and certain states like Terengganu is also not doing so well in terms of vaccination. I think more effort needs to be put into the question of vaccine hesitancy, vaccine apathy. But to your question of equity, it's really great again that the federal government has given the go ahead to vaccinate everyone, regardless of whether they are documented or undocumented migrants, refugees. But I think reaching out to them still remains a problem. And so, it's good to see when you go to these PPVs and, where now people can walk in, you see a lot of foreign workers coming in for vaccination. But I dare say those who are not documented will still be afraid to come forward to be vaccinated because of fear of arrest. And so, ways have to be found to work with community leaders who work with these undocumented migrants and refugees, to go to them, to like I said before, first of all, to provide the right messages, so that they accept the vaccination, and B, to actually go to the ground and provide the vaccination to them because of this fear of arrest. The second group is prisons and detention centers. I happen to work or have a research project at Kajang Prison for many years now. Even as an insider like me, I'm still not clear whether we are vaccinating prisoners or not. The message that I'm getting from the team is very mixed, and whether there is a vaccination program. As I said, there is this blanket vaccinate everyone policy, but whether it's getting to the people most in need. And prison being a closed space, we all know, and again, Dr. Raza and I were chatting before, have had many infections and outbreaks in, I would say nearly all the prisons and detention centers across the country. So in fact, vaccinating them and prison staff, I believe, have been vaccinated, and their families is something quite urgent. I think if we want to bring down the infection rate urgently. Thirdly, those living in PPR flats and low-cost flats all across the country, particularly in big cities, because of this digital divide, may not be so savvy with registering themselves on MySejahtera and things like that. So once again, more effort needs to be put in to reach out to them. And again, looking at the pattern of current infections, it is being seen coming in families living in low-cost flats and so forth. So I think when we talk about national vaccine equity versus global vaccine equity, these are some of the areas, those hidden population and those left behind.
All right, great. Thank you, Dr. Adiba. Now, I'd like to move on to how the COVID-19 pandemic has forever changed our world and our lives. Our re-emergence from the pandemic is reshaping the economy, government, and business in lasting ways. It has changed how we work, learn, and interact with each other. But let's get into specifics, and we'll start with you, Dr. Sabaria. The COVID-19 crisis serves as a catalyst for public sector transformation in many countries. Public sector workforces are being asked to work in novel ways and new contexts in the effort to deal with the pandemic. Now, in the context of the Sarawak civil service, where are the opportunities for transformation, and what does this transformation mean for the public sector? Doctor, I believe you're
right.
Yes.
Razi, sorry. Before I go and dwell into your questions, I would like to thanks again the other speakers, other panelists. In fact, I must say that to all the panelists too, we are blessed in Sarawak to be able to ramp up our vaccination rollout in a successful manner. Professor Andrews' kind of report has been very, has been very comfortable for us in the sense that now we are having 60% of the needed population has been vaccinated, with the first dose, and 40% for the second dose. Of course, looking at the situation that we are given a very small window until 31st of August, so that we can move into a more comfortable, so to speak, the election or whatever day that we are going to have, because these are lessons learned from Sabah and so forth. So considered blessed too that, again, the public sector has to actually mobilize in a different manner. A policy of one size fits all does not really works. It really has to actually work on the premise of we have to see the context, see the context and of the situation where we operate. Excuse me. Well, the pandemic, very well, is, as I say and stress again, is unprecedented. And the crisis has affected many lives and livelihood. I don't like to say this, but this is the realities, right? The state government has responded in Sarawak pretty well in deploying the resources where it's needed most. For example, the safety nets through stimulus packages to those impacted by pandemic. So it's at a national level. In Sarawak, we have the BKSS now is 6.0. Bantuan Khas Sarawak Ku Sayang. But we also have the support. We also have to come up and really complement the effort of the healthcare system, complementing other federal agencies working in synergy. In short, the crisis can be seen as unlocking significant activity within the governments, but there are important questions around the sustainability of this and what governments need to do to build a deeper and more entrenched capability to allow for transformation, not only in response to a crisis like this, but a transformation that meets a longer term needs that can support what the governments and the people aspire. That is the recovery plan. So to speak, at the national level, this is also being looked into. However, I must say that this pandemic is a living lab. The crisis calls for effective, inclusive, efficient public service delivery. So the need for a continuous adjustments, response, and policy change accordingly to needs and to the local needs. So again, as I want to stress, a policy of one size fits all does not work. As Prof. Andrew was saying, when we roll out the PPVs, for example, and in different division, different districts and localities, communities, we operate it differently. And of course, for example, even in Kuching, I'm very concerned when we have a bigger population. So we have actually what we have done. The PPVs have and the resident office have worked pretty well with the ADUN members. To actually mop every kampung, every villages, to ensure that everybody is being vaccinated. If we were to depend alone on the MySejahtera, this may not happen. So we have to have that twin track and so forth. So the innovation that we have to adjust to the needs of the local environment is very, very critical and need to be done fast. The decision has to be done fast. So fast informed decision that required also reliable data and information sharing. This has been mentioned much earlier, and many of us, all the panelists, has somehow rather deliberate on the need for a greater attention to information sharing. We possibly have to live with this COVID. There's no two way about this. As such, the ability of the state machinery to address long-term solutions largely depends on having the right sets of data to work on, and of course building up the capability of the public service. I just want to dwell a little bit on the effective communication as key in engaging with citizens. Framing communications in a way to empower and engage citizens in the right on the right data against regarding the virus, either by sharing relevant open data sets, Yeah, this is something that we have to look in the future. Yeah, working with social media influencers or local celebrities, yeah, may even amplify messages could yield the necessary outcome. Yeah, we have to change the modalities of how we operate. Yeah, engaging communication efforts has required governments to adapt to messages to reach a different segments of the population. For example, the children, the young people, the elderly, because it needs a whole wide community to raise these concerns and raise the living with this pandemic, living this with this virus, and of course greater use of audience insight, which is an area that I believe is still there is a gap. Yeah, we will need to further strengthen in the long term. Yeah, when it comes to communicating effectively, being informative is not enough. Yeah, the growing fragmentation and diversity of our audience call for a tailored communication messages and selection of the most appropriate channels of engagement. For example, yeah, targeted audience by Instagram or TikTok now, yeah, or Facebook, yeah. Now we have TVS, yeah, where that Professor Adiba was saying, yeah, we have local communities with local dialects, which maybe appeal to a different sets of audience. Yeah, I would like to see that more. Yeah, meaning because we are raising the community awareness, concerns, and to be adapt to the new environment. Yeah, whole government approach seems and seamless government and the need to continue to co-create become the order of the day with local community become the order of the day. Yeah, there's no such thing as government knows best. Yeah, but we have to work with the third force. Yeah, but mind you, another area that I would like to stress is good governance and good practices to sustain the people trust. Yeah, of course there are things during the crisis that we have to do. Yeah, a lot of decision has to be fast, but making sure that these areas of good governance and good practices on the long term. Yeah, because we're going to be in this pandemic. Well, if it becomes an endemic, how are we going to actually support all this? Yeah, as government relax their control and procedures, if not monitored, we may end up with wastage and abuse of authority. Yeah, I hope it's not. Yeah. Then there's also, besides short-term measures, our Chief Minister just launched the Post-COVID Development Strategy 2030, yeah, a recovery roadmap to propel the state towards economic prosperity, social inclusivity, and sustainable environment. Yeah. To end just a little bit more here, I would like to stress, yeah, I have mentioned two things which is critical for a public sector transformation. That is the process, the technology, yeah. But key to this also is, road to recovery for us means we need to steadfast in building the capability of public sector to support this agenda. And if I may stress again, and key to all these and prerequisite to that is to ensure to have the capable public sector leaders, at all levels, who are honest, who are dedicated, and who can command respect of public servants and citizens alike. Yeah, whether we like it or not, civil society automatically will be at our doorsteps. As we move to be a developed nation state. I would like Razi, I would like to stop here. Otherwise I would have more to say on this area which I'm passionate about.
All right.
Thank you very much.
All right, thank you so much, Dr. Sabaria. A lot of very interesting points to glean from that. Unfortunately, we are almost nearing running out of time, so we'd like to quickly move on to Dr. Rohaizat. Dr. Rohaizat, it is also necessary for the healthcare system to adapt and change to address the strain and overburdening caused by rapid increases in cases. So what does transformation mean from the perspective of the healthcare system and public health policy?
Thank you, Chair Razi. Thank you, Chair Razi, for the difficult questions. It's really difficult, yeah. And to me, in line with the managing COVID, the COVID-19 transformation means implementing whole of government approach and whole of society approach. But this is not just theoretical. Not just theoretical. It's not just words. It's the real practical terms. Yeah. As I mentioned earlier, I repeat it here, public health activities adhering to SOP must not only be implemented by MOH, because you can see noises out there. MOH does not do this, does not do that. I think it is wrong. It is not only by MOH alone, but by all other agencies I mentioned to you earlier. Ministry of Human Resources, Act 446, Ministry of Local Government, all the shop and so on. Prison authorities, we got so many prison cluster, Benting, LD, Kepayan, Pokok Sana, Keluang, and so on. And this, all these detention center, district officers, head of village, private sector employees, you know, they must prepare the meeting room with sanitizer, make sure their staff has wear mask before they enter. But sometimes the boss also do not wear mask, is what happened. Yeah, and the factories, the industries, the private firm, NGOs, the community, this is the real transformation. In managing COVID, we do not need only MOH. We need everybody play their part. I mentioned just now, targeted screening by not only performed by the MOH, by the Majikan, by the employers, by the Rumah Panjang, by the prisoners, prison authority, and so on. And after the screening, don't forget, isolate them, do the contact tracing. Do not wait for MOH. You know what happened in Sabah? We have learned from Sabah now in Selangor, and the Ketua Kampung, Ketua Rumah Panjang must help. You know, like when they come back from school, one of them positive, the school should do their simple contact tracing immediately before waiting for the MOH. And targeted sanitization, I mentioned earlier, employers also must provide the accommodation and so on. So the community empowerment is very crucial, I already mentioned, and these are basically what I feel transformations. And we have many evidences, many stories, and I think all of you and then out there, everybody must play their part. For example, what happened in Sarawak, gathering at Baptist Emmanuel's Church, Sarawak, although not allowed, but they gathered together. And then following that, Malaysia recorded our first COVID death of the 60-year-old person on the 17th March last year. And then after that, you know, last year, some private hospital brought patients from outside and to be treated, and do not follow much the SOP, and the patient turned out to be positive, and that hospital ran into trouble. So you can see, it is not just MOH. And then the election in Sabah end up with cluster, you know, in Sarawak, Bah Sayap, 1st of January 2021. And we took nearly 2 months to clear that, yeah, and 96 cases were detected. And again, cluster Pasai, originated from Johor. Yeah, the contact person, the first swab was negative. So why must do second swab? Why must be quarantined? Okay, we go. Then they went to Sabah. They went to Sarawak. So initially affected Rumah Panjang, Pasai, Siong Sibu. And after that, other Rumah Panjang was affected. Finally, not only Sibu district, but also 20 other districts, Muka, Miri, yeah, Sri Aman, Kanawit, Kapit, Simunjan, Dalat, Kuching, Bintulu, Julau, Sarike, Selangau, Beluru, Betok, Belaga, Subis, Song, Lundu, Bukit Babong, and Sebau. You can see just 1%. How many people were infected? 2,693. How many deaths? 29. Only we managed, that was started from 7th of January, and then only recovered a few months ago on April. However, yeah, that are important, the transformation, and whatever it is, Sarawak, I think, was once, and Dato' Andrew became our role model. Your cases were at that time very low, and I think the action taken by Sarawak State Government and the Rakyat of Sarawak are commendable. I think must be congratulated. Travelers who come to Sarawak must be swabbed. They must do swab. Right? Whether you come from Semenanjung, you must do swab. And now I noticed the hospital in Sarawak implement aggressive policy. All cases are admitted, you know, not like in some state in Semenanjung. In Sarawak, all cases, whether category 1, 2, are admitted. So you no longer implement HSO. I think it is congratulations. And Sarawak is already entering phase 2. The phase 2, the recovery phase, wonderful. And you know that as of 25th July, I mentioned just now, 81.3% of adult population Dr. Andrew already mentioned, adult population has been vaccinated with first dose. This is the second highest in Malaysia after Labuan. And then 55.8% already received your second dose. So see, the moment you got the first dose, you already developed the immunity. That among others, your cases, severity 3 and 4 become reduced. And as you know, yesterday, Malaysia detected 14,516 new cases, which is the highest. Is the champion was Selangor, always for the past few weeks. But Sarawak only recorded 356 new cases. And Arnott Sarawak was the second lowest in Malaysia, which was 1.02. I think it is congratulations. And I think although vaccination has been done, I think we still have to implement what Ministry of Health mentioned, CAPP. C means cegah or didik or educate. A means amal. Amal means practice. P means pantau, monitor. And P means patuh. And then the P is pantau, CAPP. So we have to continuously educate our people and make them practice or amal and make them patuh. Because you can see even in TV, you can see Cik Mak Razi watch TV and then people wear masks like this. So sure, the chin will not get COVID. Yeah, because that person protect his chin, but his nose will get COVID. And then one occasion I saw in TV, a person while talking covered his nose like that. Oh, good. Yeah, the nose will not get COVID, but the mouth will get COVID. So what I'm trying to say here is that not only educate, you must practice, and then after that must practice, and somebody else must pantau. We can be ketua kampung and so on, and wear mask properly, and then no shake hand. You know that they can transmit that one. No fish bump. The only bump is allowed currently by MCAN is only tiger bump. Yeah, the rest of the bump is not allowed. So with that, I think that's what I mean by the transformation. Yeah. And over back to you, Cik Mak Razi.
All right, thank you, Dr. Rohaizat. Looks like our panel is unanimously applauding Sarawak's achievements in the fight against COVID-19. And this is testament to the Sarawakian people's dedication and discipline when it comes to complying with standard operating procedures, among other things. So moving on, Dr. Adiba, this question is for you. COVID-19 has exposed major gaps in the healthcare systems of some of the most advanced countries of the world. The pandemic has created a burning platform for healthcare reform in the United States, United Kingdom, France, and many developing nations. COVID-19 will force the healthcare industry to transform and provide care that is more equitable. This will create new opportunities for many who are involved in building the new system. Malaysia is no exception. Where are the opportunities for strengthening and transforming our public healthcare system?
Yeah, Razi, I think this is a real opportunity for us in Malaysia to take a deep breath, step back and see how we can, as Datuk Sabariah said, build back better, particularly for the health system. It's not just we are struggling, as you pointed out, even high-income countries have been struggling. And if we're honest with ourselves here in Malaysia, we are struggling because I think, for decades, there's been underinvestment in public health in totality. When I mean public health, it's, the money given to the public health sector for acute care as well as for the discipline of public health. Unfortunately, the policy and pivoting to the privatization of healthcare and the hope of the economic advantages of having health tourism and all that in a sense have kind of hampered our COVID response, which has largely been in the public health sector, whether it's Ministry of Health or in teaching hospitals. And certainly the public health, the discipline that Dr. Andrew is in, has been even more underinvested over the decades, and now we're in a way paying the price. So the percentage of the GDP that has been, I mean, I know that in terms of the overall budget, health comes second after education for the federal budget, but still it's much less than what it should be. I think it hovers around 4% of the GDP, when for our level of economic development, it should really be around 7 or 8%. So number one is the underinvestment in terms of the dollars. Number two, where that money goes to, I think for decades it's gone into acute healthcare, building hospitals, etc., which of course it's needed, and especially for a state like Sarawak, you need more hospitals, or more clinics, and all that, especially in the rural areas. So in terms of health transformation, I think we also, in addition to filling up all these gaps that have been, around for years, like paying more attention to states like Sabah and Sarawak and rural areas, I think shifting much of that dollars to preventive care and public health is going to be really, really important. It's funny coming from a clinician like me, but I also practice pseudo-public health, I suppose, in some of the HIV work I do. And now we see the incredible importance of paying attention to public health, which means preventive health, community health, and so forth. Once this, hopefully, inshallah, we get hold of this COVID-19 pandemic, the other big problem that we're facing is non-communicable disease. 50% of our people are overweight or obese, nearly a third have diabetes. And in many ways, the severe disease and death that we see with COVID-19 patients, at least what I observe in my own hospital, is because a lot of young people have, diabetes or obese or both. And so, part of that transformation really needs to be paying more attention to preventive health. And like what Dr. Rohaizat said, it's not just, an issue for Ministry of Health alone. If we're talking about preventing obesity in children, Ministry of Education needs to come in. The other arms of the Ministry of Finance need to come in looking at taxation on sugar, on rice, and things like that. So these are difficult policies that need to be debated and discussed. But basically, we can't go on the way we are in terms of the health system as we have at the moment. We haven't even talked about, the aging population. Looking after someone who is 70 years old versus someone who's 40 years old is going to cost more, right? And so when we're totally not prepared for this aging tsunami, we need more community care-based models, people who can go to the elderly, provide them support. We need more community-based workers, physiotherapists, occupational therapists, social workers, community nurses, etc., etc. So the focus on specialist care, super specialist care, yes, that's needed, but really, I think what's need to be urgently built is, geriatric care, home-based care, community-based care, and preventive care. So that would be where I think the health transformation needs to go. And hand in hand would be, the big news at the moment is the Hartal doctors and all that. And I fully support their requests. But at the same time, I think we need to see how the training of future doctors, specialists, nurses, pharmacists need to be to cater for this, the aging population, the increase in NCDs, etc. So a big health transformation program it should be on the cards.
All right, wonderful. Thank you so much, Dr. Adiba, for the very insightful points. Well, this has been a really fascinating and engaging discussion. And I want to thank everyone for the really eye-opening answers. Unfortunately, we have ran out of time for the main panel discussion, but the learning doesn't stop there as we now head into the Q&A session. So you get to spend a little bit more time with our lovely panelists here. So we have received your questions and we'll read them out to our panelists there. And we'd be grateful if our panelists could keep their answers as concise and to the point as possible, maybe 2 to 3 minutes, so we can take as many questions as we can. So yeah, let's start with the first question from our participants. This question is directed to Dr. Andrew. This one is from Anonymous. Well, some are quarantining at home and some are quarantining at quarantine places, quarantine centers. What is the quarantine procedure nowadays, Dr. Andrew?
Oh, okay. When we talk about quarantine procedure, we have to remember that it is based on the current COVID situation in a particular, not just country, but even in a state and region, for instance. So in terms of countries, you can see that the quarantine procedures for countries like Australia, New Zealand, and so on will be very different from countries where the number of cases are very, very high. So what I'm saying here is, when you look at what is being done in Malaysia and in Sarawak and say this country is doing this country is doing that, why don't we follow them? It has to be tailored to the current situation in the country. Okay, so I'm going to talk about Sarawak because I think a lot of you are from here, from Sarawak. So at the moment, we are quarantining two categories of people broadly. The first one is those who come into Sarawak from outside Sarawak and outside Malaysia and outside from the other parts of the world. So because of the Delta variant, now we are more strict again with quarantining. We are doing 14 days quarantine now and fully in hotels and so on, especially for those who come from outside Sarawak. And we are going to take the sample on the 14th day, and based on the results after that, then the person will be allowed to leave or vice versa. Okay. So for those within Sarawak, we are going to quarantine or isolate those who are close contacts to known cases. So, and these are done, as was mentioned just now, we are not quarantining people at home because we find that it is very difficult in the context of Sarawak to have a proper quarantine at home because houses are very small. It's very difficult to truly isolate them. So we have them in quarantine centers and so on. And it's also going to be in quarantine for 14 days. So if you read about what is being done in Peninsula and so on, it's because the system cannot cope anymore. Whereas for us, we are at this situation where currently we can cope, and the quarantining orders will change as the pandemic or epidemic levels change in a particular area. Okay, so that's my comment. Thank you.
All right.
Yeah, if I may add, Cik Razi, if I may add, I think what was mentioned by Dr. Andrew is true. Meaning the management of quarantine is basically country specific and also state specific. Because last time, earlier we changed the policy from 14 days. And then we detected that after 10 days, the virus died. So they reduced from 14 days to 10 days. But after that, now the new virus come in, the new variant. So either 14 days or 21 days if the travelers come from overseas. And not only that, for those who are in contact with the positive, I think what Dr. Andrew mentioned also very true. Because we have to look at the other aspect. For example, if that person is very, very rich, and they can be quarantined at home. But if they are very poor, they do not have a specific toilet, so they have to be quarantined at specific area. And some of them, they might be mild cases, but they have a lot of comorbidities. So in short, quarantine criteria varies, So you're up to the specific state and the specific country to tackle this. Yeah, and it depends on the situation. That my additional input to that to Dr. Andrew.
Yeah.
All right, great. Thank you, Dr. Raizat and Dr. Andrew. Next question is for Dr. Adiba. Companies, organizations have put in place strict SOPs, yet till now, workplaces are the biggest contributors to the increase in infection. So what can be done now to stop the increase of infections at workplaces? Quickly, Dr.
Yeah, this is a very big problem, isn't it? And it really speaks to the need for proper SOP as well as enforcement. I think one of the main reasons why workers are getting infected, and certainly this has been the experience not just us, but also Singapore and Thailand, where in countries where we employ a lot of foreign workers, it's the places where they live in, the dormitories or even rented houses. Everybody's cramped together in crowded, fully ventilated spaces. So until and unless we address that, comprehensively, as well as vaccinate all of them, we're going to run into this problem. The SOPs that's put in the workplace itself, the distancing, masking, etc., is well and good. But if they return to where they live and sleep and are packed in like sardines, that's where the infection occurs. So I completely agree with the person who's asking the question that I think not enough attention has been put to this. And if I may say, whenever I have the opportunity to raise this, at sort of national level forums or meetings, Ministry of Health will say, but this is a problem of Ministry of Human Resource. Ministry of Human Resource says this is a problem of KDN and immigration. So that siloed way in which government agencies work is also not helping. So I'm really thrilled to hear of the way Sarawak has approached the vaccination program in terms of bringing in your so-called third force. And of course, in terms of educating the migrant workers, we need to work with community leaders, those working with migrant workers, etc., to provide them with the right education of both the public health measures, the masking, the distancing, the hygiene, the importance of ventilation, as well as the importance of vaccination. So if there is ever a group that needs that whole of society approach, this would be it. Enforcement, I think, for me, I think enforcement shouldn't be to the individual workers. Enforcement should be towards the factory owners who do not provide adequate housing, adequate and humane housing situations. Enforcement should be towards owners, employers who don't ensure that their workers are vaccinated and who don't provide masks and everything else that needs to be done to ensure that they don't get infected.
All right, thank you, Dr. Adiba. Considering we have still so many questions left to go, we have decided to extend the Q&A session by 30 minutes. I'm sorry, I know you guys are all very hungry and you can't wait to get your lunch, but just a few more minutes, just a few more questions. Right now, we are opening up the questions for all panelists. So any panelist can volunteer to answer any questions that I pose. So the first question, will there be a likelihood of us needing a third dose of vaccination based on what we hear in the news? This question is open to all. Any takers?
Maybe I can jump in there unless Prof. Andrew, Dr. Andrew or Dr.
You go
Raisa.
first, Adiba.
Yeah.
Okay.
So I think that the question really is, first of all, it depends on which vaccine you've had. The short answer would be that we don't know, that even in the US, where the vaccine rollout has been quite extensive and a lot of research into the immune response. Recently, there was a joint statement by FDA and CDC to say, that despite what Pfizer is saying that a third dose, a booster dose is needed, CDC and FDA very quickly came out to say that there is not enough evidence at this stage to say that a booster dose is needed. But that's in relation to the mRNA, Pfizer and Moderna vaccines. With the Sinovac vaccines and all that, the big problem there is there hasn't been enough, research into the detailed research into the immune response and the length of, the immune response, the effective immune response. What we know is from effectiveness seen of rollout in countries like Chile and UAE and others. So I think this is where it's really, really important that we in Malaysia do our own research as well to monitor this, because it's an unknown, uncharted territory in terms of should we mix you have a lot of people been given Sinovac in Sarawak. Should the second dose be of the mRNA type of vaccines, particularly if the circulating variants is Delta or Beta, whatever. So just like quarantine rules need to be adapted to local situation, I think vaccination programs also need to adapt to what's happening in science. Having said all that, I think it's also very important. People are going out to buy antibody or to have the antibodies tested. Now, again, the antibodies that test that's available on the market doesn't help. If you're negative, it doesn't mean that you haven't developed an immune response. If you're positive, we don't know if that immune response is good enough. So I would suggest don't waste your money going out buying the antibody kits. And secondly, the immune response after both vaccination and natural infection is very, very complex. It's not just the antibody, but also the B and T cells and memory cells and all of that, which remains in the system, and inshallah will provide you the protection that's needed. And we can't measure that easily. Mm-hmm.
All right, thank you, Dr. Adiba.
So Razi, I would like to add to that. So this is important for us, as I mentioned earlier. 80% of our vaccine is Sinovac, and unfortunately, we don't have as much data from developed countries compared to those who are using Pfizer and Moderna, for instance. So it's truly, we truly don't know. But yesterday, during the soft launching of the Sarawak Infectious Disease Center, the YAB Chief Minister I think he mentioned that the Sarawak Infectious Disease Center is going to conduct a study on the measuring of protective antibodies against those who have been vaccinated, And this will be done by the Institute of Health and Community Medicine, UNIMAS, together with the SIDC. So we hope that, and they are looking at protective antibodies, this one, what is called neutralizing antibodies. And they're also going to look at whether they are protective against the Delta variant, for instance. So unfortunately, this will take time. The data from this will take time to come because now our vaccination is still in progress and so on. So hopefully we will have some form of information before the end of this year, the first set of tests that will be done. Okay, that's my comment at this point in time. But as of now,
Great.
we still don't know the answer. Okay,
Yeah.
back Razi.
All right, thank you, Dr. Andrew. Don't go anywhere just yet, Dr. Andrew. This next question is for you. We haven't actually touched on the elephant in the room, and that is mental health. So this question from our audience is it touches a bit on mental health. Looking towards the rising numbers of the COVID cases recently, those who are unemployed, now the rate of suicide cases are also rising. How do we actually ensure each and everyone has personal resilience? I believe they mean mentally by that. Yeah.
Oh, okay. I think it's easier for me to show. The first one, I go straight to the end first, and then I will go back to resilience. So for those who are, there is a whole range of psychological, mental health, and other problems related to COVID-19. They relate to people who have the COVID-19. They relate to families who have COVID-19. They relate to the community, and they relate to even and more so to the frontliners who are looking after these patients and so on. So there are some who are at the very severe end of the spectrum, and for those who need these kinds of help, then I would like for Sarawak to highlight here that you can call the Mental Association of Sarawak. The numbers are here, and they also have WhatsApp. And then just on July 12th, which is just about a week ago, the Sarawak Social Welfare Department, they had a telecounseling service, which was in operation since March 2020. This was mainly meant for the frontliners before. And then they have rebranded it as community chat, and now it's open to everybody. And you can call the numbers here, 082-311-554, and this is 24 hours. So for those who are very severely affected, then I advise that you look at the Mental Health Association of Sarawak as well as the community chat websites and call them. And for those who are at the ultimate end of the suffering, then the befrienders will be what you are looking for help. Okay, they are there, and these are the numbers that are there. And we can also look out for people who are having signs of suicide, for instance, how they talk, whether they feel trapped, they talk about killing themselves, behavior. If someone has a behavior of withdrawing from people, saying goodbye to people, and then their mood, depression, and so on. So you can help them to get help and recognize. So that's for those who are at the severe end. For the rest of us, I think I would like to just show this quickly, that resilience can be seen as a seesaw like this. And how do we improve our resilience? The first one is to remove this, the negative part. In short, you can see that where possible, we can remove the negative part here, unload them. The second one, of course, is to load up the positive side here. And the third one is to strengthen our core skills and so on. This is how we cope and so on. And the 4 ingredients of our core thing will be that we have hope, that we have connection, that we have purpose in life, and that we are adaptable and flexible. I think this is the short answer to a very complicated situation, Razi. Okay, thank you very much.
Thank you, Dr. Andrew. Unfortunately, we have seemed to lost Dr. Adiba, as she has other priorities to attend to. So we'd like to thank her for lending her time and imparting her knowledge for all of us. Yes.
Razi,
Yeah.
I just want to highlight a number of initiatives that we continuously in the public service, yeah?
All right.
That we are trying to engage and get our public servants more informed, and also, in fact, we have, in an era where you have misinformation or lack of information or over infodemic, we call it, yeah. So our head of department groups, our COVID management groups, you know, so that's where we verify some of this, what you call that, information. At the same time, we are continuously providing platforms like this, yeah, on a regular basis, yeah, either from the Leadership Institute in the form of executive talks, yeah, so that our public servants are there to actually get the letters. And at the same time, even tomorrow from our HR, Human Resource Unit, yeah, this is also regular, that we are going to have what you call as sharing session by our engagement program, leadership and crisis management, policing the COVID-19 pandemic in Sarawak, by Dato' Aidi Ismail, Pesuruhjaya Polis Sarawak, yeah, in a Zoom session as well. These are a number of things that keep on going, keep on moving, and keep on motivating, as well as become a platform for everyone to share their concerns, provide the feedback, and also for us to have a two-way communication with our public servants alike. Yeah.
Okay, Razi, if I may add something just now,
go ahead,
regarding the HSO, the quarantine, and the need to follow SOP lah. The purpose of quarantine basically, if we cannot control the persons, so the best is, and they cannot follow SOP, the best is to be quarantined at the proper place. And we already have the evidences, you know, the cluster Sibaganga during the second wave. We managed to reduce the cluster and close the cluster Sri Petaling. Yeah, the biggest cluster Sri Petaling. We managed to close it. And after that, we got another cluster Sibaganga. Why? They're supposed to be quarantined, but they did not. And how many people have been infected? It affects Kedah, Perlis, and other places. Meaning here, the quarantine is very important to control the spread. And it is become mandatory if they cannot abide with SOP. So you can see that. And that is the example of not following SOP. As a result, you get the cluster Sibaganga. And then after that, you remember the cluster Tawar. That another cluster. Yeah, the cluster Tawar, they go to the funeral, they don't follow SOP, we got high that, bigger number. That's why quarantine of the contact, doing the contact tracing is very important. And look at the other thing, what happened in Sabah. After the election, we got so many clusters start with Bah Manggis, Bah Arnab, all Bah, because they are from Sabah. Because why you don't follow SOP? As simple as that. And then you heard about cluster Inai and cluster Jambul. Why? Potong Inai and Berinai and cluster Jambul. Because they potong Jambul, they don't follow SOP. Of course, Dato' Andrew and me don't have Jambul, but Razi still have Jambul. You can still cut your Jambul. Okay, following SOP, HSO is mandatory. And then you heard about cluster Pasai. One test for negative. Oh, I'm confident. So went to Sarawak and caused what? More than 20 districts affected. So that is the reason why the quarantine following SOP is very crucial. Otherwise, you cause chaos and so on. Crowded place, it is very important because we want to make sure the accommodation is good, because they don't spread the diseases and so on, particularly at tempat kerja. Why crowded space? If you can recall last time, the cluster Sri Petaling. So how many people gathered together? 60,000 people gathered together. 1,005 were Malaysian, 4,005 were non-Malaysians. After that, they went back. The first case was detected 11 days later. But what happened, what I'm trying to tell you, when they went back, they stay in one place. That's why penginapan is very important. Act 446 under the Ministry of Human Resources is very important to be implemented. Because when penginapan is not good, they got infection at penginapan. Tomorrow they go at Pasar Borong Selangor. And then one of them went to construction at Shah Alam, another Cheras. So after that, Pasar Borong Selangor, you got another cluster. And then also one of them worked in Pasar Borong Chokit. So after that, Chokit, KL, and also up to Negeri Sembilan. That's why the 3 basic vaccine, i.e. physical distancing, minimum 1 meter, wearing mask properly, and sanitization are very crucial. Yeah. And talking about vaccine just now, yeah, the efficacy of vaccine, and there are currently 3 types of vaccine. You know that mRNA, the new one. Another one is the AstraZeneca using the virus vector, and the third one is the Sinovac. Sinovac is basically the traditional vaccine. I've taken Sinovac, and studies have shown in Chile and also in Israel both effectiveness of Sinovac and Pfizer not much different. Yeah, but to me the most important vaccine is that number 1 is physical distancing. Number 2, wear mask. Number 3, sanitizer. And number 4, don't be choosy. You must grab whatever vaccine available. The moment you are vaccinated, immunity will go up. And just now the question whether you have been vaccinated, you do not know. You might not be vaccinated. So I suggest you report to the police, because there may be some scrupulous person, report to the police if that happened. But if they have taken that vial, they must keep that vial, in cold chain temperature. They cannot just sell, because if they sell to others not in cold chain temperature, basically others are buying the what we call destroyed vaccine. That is why some of them they're taking photo in many PPP center. After they have given the vaccination, they show you the vial. See, this vial is really empty. I get to throw. So this is very important for the public. When they give you the vaccine, see the vial, and then they should let you know. However, if you're still not sure, you can do the antibody testing, antibodies testing, just to make sure whether you are being vaccinated or not. That is my quick response, Cik Razi.
Okay, right. Thank you, Dr. Raizat. I believe we have time for 2 more questions. This question is open to all. This is from Harry Bruce Edwin. The vaccination program is targeting those 18 years and above. And since schools are about to reopen for face-to-face learning beginning September 2021, what is the government doing in terms of initiatives and efforts taken to protect school-going children as they are not shielded with vaccines? Any takers?
Dr. Raizat, can you answer national policy?
Maybe Dato first. You are the advisor to, but
no, we have of course in the case of Sarawak to a large extent we also follow national policy regarding vaccination and so on. Of course we can suggest to the state government to do some minor modification and so on, but by and large we will have to follow the national policy on it. So at first the vaccines were given only, were tested, the trials were done among people who are 18 years and above, because for children then you need to take extra care when you're doing the studies and so on. So in the early phase of the pandemic, we don't have information regarding whether it's harmful and useful for those below 18 years old and so on. But now we have data from Pfizer and others who already have data from 12 to 18 years old. And in some countries, in fact, they're giving them to these children. But there were incidences of young people having myocarditis, which is an infection of the heart when they receive some of these vaccines. So I think because of that in Malaysia, what they do is they recommend these vaccines only to adolescents who have comorbidities. Some of them may be obese, some of them may have health issues and so on. So at the moment, that is the policy, the national policy at the moment. Of course, things will be updated and policies will need to be changed as new information come in. I think that's my comment at this point in time. Dr. Raizat, can you add?
Yeah, I think I agree with Dr. Andrew. Basically, if we look at the experience of other countries, when they did this study, they test for the people aged 18 and above. So when they did the studies, Sinovac, Sinopharm, AstraZeneca, they did it for the individual age 18 and above. Yeah, individual 18 and above. So the question is it safe to immunize people below than 18 years old? Because the first cohort started with 18 and above. Yeah, that is the first point. Number one. Number two, many countries, yeah, that is the beginning. What I mentioned to you, the beginning when they did the study, they did that on for the person age 18 and above. And number two, developed countries like US, Singapore, and so on, they already immunized their phase 1, phase 2. So they already immunized those age 18 and above. And then what they did now, they are doing the study, they immunize people between 18 and 12. You can see that. So they are collecting the data. So many developed countries now already starting immunizing people between 12 to 18. So, and then including Singapore. If I think some of you, you got friends been immunized by Pfizer, by AstraZeneca, and so on. Yeah. So some of them got side effect. Imagine if you immunize to young age group, even the elderly, the elder cannot stand. How about the youth? Yeah. By the way, so I am sure studies conducted by other countries then will later be will shared with all other countries all over the world. Meaning from just now from 18 and above, and then from 12 to 18, I think this group will be covered. Yeah, 12 group. But supposing, yeah, after we discuss the data from other countries all over the world, from 12, 18, 14 up to whatever age covered, but still person below than 12 will not be covered. So this another portion, will get infection. We will not get 100% ability to eliminate COVID-19. And I'm sure all other countries all over the world will do study to look into whether below 12 also can be vaccinated. And we are eager to wait for the result. That is why the moment you have been vaccinated, remember, yeah, you are protected, but small percentage will still get COVID. And if you go to crowded place, you don't wear, you might be infected. You don't wear this, you might get infection. Number one. Number two, when you get infection, you may be mild, you might not know. You go back and meet your kid. Your kid still can get infection. Yeah. That is why until we get the herd immunity, the basic vaccination, as I mentioned to you earlier, 3 items: physical distancing, wear mask properly, wash hand, still vital. Wherever you go to the shopping complexes, you go to the wet market, you go back to the office and so on, particularly crowded areas.
Yeah, I would like to add that this issue is going to be more and more important because now the age group of the people who are getting COVID has shifted. Now we have more cases, relative more cases who are in the younger age group, for instance, and a lot of them are below 18 years old. So unfortunately, we cannot give them the vaccine yet, but this highlights the importance of them taking care of themselves, as Dr. Rohaizat mentioned, social distancing, physical distancing, wearing masks, and so on. And that is also one of the reasons why one of the SOP is that children below 12 years old and so on should not be brought to public spaces like malls and so on, because we need to protect them as well. Okay, Razi?
Right. Thank you so much, Dr. Andrew and Dr. Rohaizat, for the really thorough answer on that question. I believe the person who asked the question will get all the satisfaction and all the answers that he or she needs. We'll reserve the last question for Dr. Sabaria. This question is, if work from home is going to be the way forward, organizations ought to look into improving the processes and improving the standard operating procedures of working from home. After more than a year now, some organizations have not had a well-balanced work from home SOP, also look into the welfare of employees. Any thoughts on this, Dr. Sabaria?
Thank you, Razi, and thank you for our public servants who are asking these questions. Yeah, of course, everybody is everybody's concerned now is, it looks like work from home is going to stay. Yeah, and of course the need for everybody, in fact, to juggle. Yeah, to juggle working at home. Yeah. And it's not as simple as when we go to the office. We have that level of concentration, we have the level of attention. But having said that, if we work from home, is a totally different environment altogether. Yeah. At the same time, we understand the fact that working from home means there are also issues and challenges facing and surrounding it. Yeah. As working from home also entails the fact that there are concerns relating to, especially now when education is also on e-learning platform, where they have to juggle between actually assisting and having their children, helping their children on the online learnings. This has become a very challenging time for many parents, especially those who have kids. You can imagine if they have 3 or 4 kids, having to have online. There are, of course, reflecting back to the questions on SOPs and standard operating procedures. We are building it up. It's on a continuous note. We are providing some SOPs now, and even, for example, through our digital government, we provide the kind of standards, especially in the kind of what you call that, a platform that we should be operating on. The kind of digital platform that we are going to use. That's most important. The kind of assets that is deployable, that is needed. And of course, as I said, this is a very trying. Pandemic is a living lab. So this is the first time that we are really operating from home. And now, of course, with the vaccination kind of success, we should be having a better number of percentage of what you call public servants at the workplace. In the manner now we are getting about 40% instead of 20% or only essential services. So the adjustment that we are making looks like it's continuous. We hope that we are able to actually getting everybody adjusting to the new SOPs, the new procedures, and also the new standards that we require everybody to comply to. On that note, as I said, that is where we are educating and making sure that the information and the SOP are being cascaded through various channels, and all our HRCs are always updated with the latest circulars and the latest information relating to working from home practices and so forth.
Maybe Dato', if I might add, Cik Razi, my experience working from home and basically taking leave at home, these are very crucial. So when I call, they reply, "I'm sorry, I'm working from home. I cannot do." So I call them. Where's mom is not here? Where's your mom? Mom is out there shopping. So a lot of people abuse the system, abuse working from home. So I think working from home must be monitored, must have outcome, because while in hospitals they all frontliners working non-stop, but the non-frontliners, they don't do the job at home, meaning, and they're supposed to handle the vouchers, the claim and so on, and the claim did not come because when people ask, "I'm sorry, I'm working from home," the word is working, but many of them not basically working from home, actually cuti from home is what happening. You can see the lot of backlog. So the responsibility of the head, to make sure. Otherwise, all these that working from home, you must send them to Pusat Pemberian Vaksin, work as volunteers, because they are not working from home, they are cuti from home. Because everybody that work from home must be given the indicator. I expect you finish 10 vouchers. I expect tomorrow all the claim must be ready. All the cuti must be ready. The paper must be done. This is actually the real work from home. And otherwise, it is basically resting at home. So this is very crucial to be implemented, to be fair to the frontliners.
Yeah, if I can add on that one, yeah, not that I'm trying to defend public service, but basically those handling vouchers and are considered as essential services. Yeah, so these are the people who still have to work at the office. They are not. These essential services are the one that not taking that work from home new normal kind of, yeah, because they are classified as essential services. Yeah, but I do agree with Datuk Professor in saying that, you know, the constant monitoring of the heads of department are still required, yeah, to provide the necessary direction, the KPIs, and of course, as I said, within the new normal, there is also a need of accountability, which I have mentioned much earlier in my closing remark on the third, on the need for transformation of the public sector, that we are actually practicing what you call outcome-based KPIs. Yeah. So whether you are at home or in the office, your KPI still stays, or there's a need to adjust to the new targets. Yeah. So the responsibility, the most important in getting this agenda on the right track is having the right capable leaders at all levels. Yeah. So I mean, these are these are very pertinent at times when we are managing the crisis. Leadership roles and responsible leaders are much needed, not just to ensure the KPIs, yeah, but to adhere to the SOPs and also the new normals at the workplace are critical. Yeah, because I think earlier we also mentioned about a workplace cluster and so forth. In fact, we have many a times have to remind, yeah, sometimes because of the nature of work from home, yeah, those people at the workplace, sometimes they feel that, you know, there are not many of them, they can eat at the pantry and all those things, yeah. So we want to be sure that whether you are at home or you are at the office with a small number of people, this new normal, this new SOP, to ensure that we are able to manage the public sector and need to be enforced by our heads of departments and also supervisors at all levels. Yeah, I must say that this is a very critical and a very needed leadership at times of the pandemic. Yeah.
All right, I think that's a great place to end everything. Thank you all so much. Unfortunately, we are out of time, but I gotta say this was a really eye-opening to me personally and surely for our participants. And we have learned a lot during our short time together. To sum it up in overly basic terms, I like to say that given that the virus won't change its habits, and that any vaccine we are able to come up with won't somehow be a magical solution, the only alternative is to transform our society, change our way of life. The pandemic requires us to redesign the economy, rethink our obsession with growth, find ways to protect the most vulnerable, use apps to trace our close contacts, share our research and learning and data, make adaptations to our public sector, and redesign everything to basically put people first, to accept that we are in a new normal. That is how we emerge from the COVID-19 pandemic as a more resilient and kinder society. Dr. Sabaria, Dr. Rohaizat, Dr. Riba, who is unfortunately not here anymore, and Dr. Andrew, I, on behalf of the Leadership Institute of Sarawak Civil Service, TVS, and our participants would like to express our utmost gratitude for your time, for being here with us today. And I'd also like to thank our audience for tuning in to this webinar and for submitting all the great questions. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Yes, thank you.
All right. Thank you, Dr. Andrew. Thank you, Dr. Reza. Thank you, Dr. Surya.
Thank you,
Before we
Reza.
go, I'd also like to thank Mr. Ismail Said, Miss Diana Mary Keppel, Miss Estia Nyopie, and Mr. Keegan Kimura, among others, from the Leadership Institute of Sarawak Civil Service for making this happen and for being such a tremendous help in setting up the webinar. Thank you, everyone, so much. All right, we'll see you soon. Before we go, for the attendees, a couple of announcements before we end the session. I would like to kindly remind all participants to fill in your attendance in the Google form provided. The administrative and announcement slide will be playing again after the session has ended. And I would also like to announce that mystery gifts will be awarded to lucky selected participants. So please kindly provide us accurate information in the evaluation form for us to contact you should you win. Also, I won't forget to mention, this webinar session will be broadcast on TVS and TVS social media on the 3rd of August 2021. That's a Tuesday at 8:45 p.m. to 10:15 p.m. I repeat, that's on the 3rd of August 2021, Tuesday at 8:45 p.m. Be sure to tune in to TVS channel 122 Astro and My Freeview, and don't forget to tell your friends and family. Well, that's it. I'm Razi Ahmad signing off. Have a good day, everyone, and stay safe. Thank you.
Okay, bye-bye.
Thank you, everyone.
Can we go now?
All right, bye-bye.
Take care. Take care and stay safe.
Take care.
Okay, bye-bye. I'm going to log off.
Bye.